Hi, I'm Chandra Price, the founder of the Medicare Teachers Brokerage. We are not affiliated with the federal government. We do not work for Medicare. We are an independent agency with brokers across the country. So if you need help, we would love to work with you. Today, we wanted to talk a little bit more about private insurance that you would receive to supplement or add on to your original Medicare card. So if you haven't watched that video, please go back and review that so that you're familiar with how Part A and Part B of original Medicare from the federal government works. So private insurance companies, this is what we help you with. They have different options that are available to you, and we love everything about Medicare. It depends on where you live, your health conditions, what your prescriptions are, and what's going to help you sleep at night. So these are the different kinds of Medicare that you can choose to add on to original Medicare. The first is Part C. Part C is also known as Medicare Advantage, and you're going to hear it referred to as Medicare Advantage more frequently than you'll hear it called Part C. Medicare Advantage plans, that's a lot of the advertisements that you see or the mail that you receive at your home, those are coming from Medicare Advantage plans because they're very competitive with each other and they're really trying to compete for your business and tell you why one plan is better than the other plan and trying to get your attention that way. So those are Medicare Advantage plans. Medicare Advantage plans are kind of replacement cards. They function kind of like group coverage when you're working, where you have one plastic card that you carry around in your wallet, and you take that same card to the doctor or to the hospital or to the pharmacy, and they take a photocopy of that and say, okay, your copay is, your co-insurance is, whatever it is that your cost sharing is. They'll let you know, and then the next month you get the statement in the mail that tells you about the services that you received. So these are replacement cards. They replace your original Medicare card. Medicare Supplement plans, just like the name implies, supplement original Medicare. So another term for Medicare supplements, and this is where Medicare can get dicey because of the vocabulary, another term for Medicare supplements is Medigap. So Medicare supplement plans and Medigap plans are two terms for the exact same thing. And just like the name implies, Medicare supplements supplement original Medicare. Medigap fills in the gaps that original Medicare leaves behind. Those mean the same thing. Now, this is also where it's a little confusing. Medicare supplement plans also have letters. So we already talked about how original Medicare has Part A and Part B. Medicare supplement plans are referred to as plans, but they have letters. So there's Plan A, Plan B, Plan C, Plan D, Plan G, Plan N. There are a whole variety of plans that you can choose from. And the reason that there are different letters is because each letter offers slightly different coverage than the other letters. So that's something that we can help review with you so that you can choose the Medigap policy, Medicare supplement policy, that's going to suit your healthcare needs. So Medicare supplement plans, you pay a premium each month to buy these plans. Now they're standardized. So a Plan G from one company is identical to a Plan G from another company. So how can you decide which Plan G is correct for you? You're going to take a look at the company itself. Is the company reputable? Has the company been around for a while? Do you believe that if the company needs to pay medical bills, that it's going to have the money to be able to pay your bills? Because that's its entire job, is to pay the bills that Medicare leaves behind. So you want to make sure that you're choosing a company that you feel comfortable working with. And then you also want to make sure that you take a look at the historical rate increases, because sometimes a plan has a very low rate when you are first turning 65 and going on to Medicare. So that seems very appealing. However, within just a few years, if you look at the trends, that plan tends to go up much more quickly in premiums than a similar plan. So a plan that looks really attractive at the beginning might not be the right plan for you long term. So you want to take a look at the historical rate increases. Of course, you can't predict the future, but it will give you an idea of how the company tends to function. The other thing that you want to take into consideration when you're looking at a Medicare supplement plan is they do not include Part D prescription drugs. So you need to get your Part D prescription drugs somewhere else. So you end up with 3 different cards that you carry around in your wallet. You carry your original Medicare card, and that pays most of the bills. You carry around your Medicare supplement card, which is going to pick up some or quite a lot of what Medicare leaves behind. And then the third card is the one you take to the pharmacy. That's your Part D prescription drug plan. And the Part D plans, those can vary quite a bit. So you want to take a look at your medications and make sure that when you're looking at a Part D plan, that you're choosing one that suits what your healthcare needs are, because what your neighbor or your friend or your parents or your cousin, they might have a Part D plan that's correct for them, but it might not be correct for what your needs are. So it really is an individual decision. Same thing with a Medicare Advantage plan. You know, somebody across the country from you or somebody who lives in a different county than you might have different opportunities to enroll in different plans than you have that's available to where you live. So you want to take into account what plans are available to you and not just what somebody says is the right plan, because that might be the right plan for them, but you don't know if it's the right plan for you. So Medicare Advantage and Part D prescription drug plans can vary quite a bit. So make sure that you are evaluating your healthcare needs. And then Medicare supplement plans, you want to make sure that you're enrolling into a plan that you understand how it works and that you feel comfortable with having a relationship with that company long term. Thanks for watching.